Hello. So, good morning, friends. At the outset, I take this opportunity to thank the organizers for giving me this opportunity. A disclaimer that this is the censor, the academic grant is from the Bharat Biotech, and the topic is beyond the bacteria, beyond the antibiotic, what can we do, can be done for the prevention of the typhoid fever. This, yeah. So as you know that typhoid is caused by a gram-negative organism, and it has three different antigen O, H, and VI. After this VI antigen is very important both for the pathogenicity as well as for the immunogenicity for the creation of the vaccine. We also know that it's a global burden. Nearly, it tolls for nearly 9.3 to 12.6 million cases uh, annually in the year 2017, with a death of 65,000, more than 65 to 1.7 lakhs. And our Southeast Asia is also not spared. And the sorry plight said that most of the things are in the reds, and it has got an incidence rate of nearly 172 to 226 per thousand population per year, which tolls for around 1.03 Delhi's. As far as our India is concerned also, that though it appears much in the age group of the 5 to 9 years, I think the adolescent and adults are also not spared. And so, if you look at the incidence from 15 years, I think it is quite high. Again, it still continues to the early adulthood of the 35 years of the age. And if you look at the high prevalence in India, you can see that 690 cases in the 0 to 1 years. Yes, friends, typhoid can occur in a child, in a children who are less than 2 years. Not only that, they have more complication, they require more hospitalization, and they become more serious because of the typhoid. And as you can look at the spectrum, that in the 5 to 15 years, the highest incidence is in the form of 5,000, more than 5,000 and more than 1,000 above the age of the 16 years. Now, there has been the scenario has been changes. Why? Because of number of calamities, floods, droughts, famine. All these are the events where there is a devastating outbreaks of the typhoid can occur, and the increased risk of the food and water calamity occurs because of the climate change, all this devastating situation, and therefore this is the situation that demands a need for a good typhoid vaccine. And another important challenge is that we are facing with the MDR typhoid since 1980. And you know that what is MDR typhoid? The typhoid which is not sensitive to our first line drugs like ampicillin, amoxicillin, chloramphenicol, cotrimoxazole. And after that, we have started using the fluoroquinolones, then we are using our third generation cephalosporin, the cefixime. But due to our iatrogenic own reason misuse of the antibiotics now, in almost the fluoroquinolones has been lost. Nearly 100% of the typhoid bacilli are now resident in the Asian countries. And in the 2016, to add a fuel in the fire, probably we have got the XDR typhoid, which was first detected in the Pakistan. So the ceftriaxone resistance. We also see in India in the tertiary care that ceftriaxone resistance is now there. Even if the ceftriaxone is sensitive, probably the MIS is creeping, and probably may not get the good response by the day 8 or 10 with a huge correct dose of the ceftriaxone. So all these are the challenges for the treatment of the typhoid, and therefore it is very, very important that this disease can be prevented with the help of the good vaccine like vaccine. Now, the policymakers across the globe has now realized that there are two important things. One is the wash technique, that is a good safe water supply, good sanitation, hygiene, and food hygiene measures. But these are found to be remote possibilities. They have a very slow turnaround time. As against it, the vaccine is our hand and it has a quick response. So the vaccine is the need of the time, and probably that is the most important part as far as the prevention of the typhoid vaccine is concerned. And this is the typhoid conjugate vaccine. We know that we have got two different types of vaccine. One is a polysaccharide and second is a conjugate vaccine. Now, out of this, the polysaccharide vaccine is now gone out of the flavor. What is currently in use is a conjugate vaccine, because once the protein moiety is conjugated, it leads to a better affinity maturation, induction of the memory cell, long life antibody production, and improved immune responses even in the children who are less than 2 years of age. So, this is a very ideal vaccine, that is a conjugate vaccine. And if we include this vaccine in a routine vaccination, it is predicted that we can avert nearly 33 million cases of the typhoid fever over 10 years. I repeat, 33 million cases over 10 years, which represent a 30% decrease in the incidence. And therefore, the routine vaccination for the typhoid conjugate vaccine is going to be a need of the hour in the coming decade. Now, one vaccine out of this number of vaccines are available, but why this conjugate vaccine from the Bharat Biotech? Because this is a vaccine that has got the more than 15 trials, 500,000 subjects were evaluated, promising saving as per the dose that is concerned. Wastage is low, but it has been used in more than 80 countries, and we have used nearly more than 80 million doses. This is the vaccine. Now it has been used as a reference vaccine, as a comparator in all other CV programs. So it is a vaccine which is a reference vaccine as far as all other TCV brands in the market are concerned. And from phase 1 to phase 2, phase 3, and now we have the phase 4 trials. We have got robust data, and we look at this, a 7-year follow-up for the safety and immunogenicity. We have also data which tells us that yes, this is a vaccine which can be administered as a booster dose. Of course, ACVF is not yet recommended, but many of the experts across the nation have said that yes, the vaccine has the boostability, and a second dose of the typhoid vaccine can be required. So these are, I will not go into the data, but you can see a very robust follow-up of the 7 years is available with this reference vaccine, that is typhoid conjugate vaccine. Now, if you look at this, all these titers, that nearly the 4 times seroconversion is 80% with the use of the booster, and the 60% seroconversion is found at 7 years with a single dose. So again, I will not go into the data of the GMT titers, but you can read that the 60% for seroconversion at the end of the 7 years means not only the vaccine's immunogenicity, but the immunogenicity persists for the longer time. Not only that, when we are using a booster dose, the type of the antibodies produced, that is the antibody avidity, is excellent, and therefore the immune response is robust in terms of quantity and in terms of the quality. So, an important aspect of the vaccine that it activates the T helper cells, which enhances the magnitude, that means the quantity, as well as the quality, that is the avidity. And you know that better the avidity, the conjunction with the antigen of the antibody is going to be very tight, and it provides a long-term immunity. Not only long-term immunity, it keeps the memory cell active. So even with a small subclinical exposure, you can have an anamnestic response with the booster dose. And this is again a vaccine that it is produced by our Indian company, and this is the first and only vaccine where the human challenge trial has been done. And you can see that even in the human challenge trial, the vaccine efficacy is in the tune of 87.1%. What you want more? A vaccine with an efficacy of 87% are going to be excellent in the real world situation, that is the effectiveness. And you can see that in human trial, we can have a TCV induced alpha 4 beta 7 and CCR10 IgA. So it what is IgA response, means it induces the plasma cell as well. Secondly, it has a long-term immunity because of the induction of the large number of plasma cells. Second, the antibody-dependent neutrophil phagocyte is also accelerated. And last one, it also imparts a different mechanism action against the VI antigen. And if you look at the clinical side, the lower median CRP level has been found after diagnosis of typhoid by culture, and therefore, this vaccine also alleviates the symptoms. So it prevents, at the same time, it alleviates the signs and symptoms of the clinical typhoid in a vaccine recipient. And this is a vaccine, we can see that effectiveness study. What is effectiveness? It's a real world situation. What we drive on the road is our effectiveness. That is similar. So we have got a number of age groups from 9 to 16 months. 9 to 16 years, sorry, you can see the subject size quite huge, and they've got the safety and effective, and some of them are the safety and the efficacy data and the safety and the effectiveness data. And if you look at this, a very proven efficacy that a non-endemic country where the chances of having subclinical infection is less, the efficacy is 87%. Single dose in India 85%, Nepal 81%, Nepal second year follow-up 79%, Zimbabwe 79%, Bangladesh 85%, Malawi 80%, and Pakistan 90%, where the incidence of the XDR outbreak is already there. Means the more than 80 or 85% effectiveness or efficacy with the single dose of typhoid vaccine. That is the beauty of this vaccine as far as TCV is concerned. So these are all the papers that I have submitted. It has been published in the New England Journal, Lancet, Global Health, or IDSA. Number of reputed journals have shown this. The data has been published. And you can see that typhoid effect is against XDR typhoid. So it is not only useful against the drug-sensitive typhoid or the MDR typhoid that we're dealing. Again, it has a 95% efficacy against the culture-proven typhoid and 97% against the XDR. Means that if you give this vaccine, probably you will not be going to use your monovaccine antibiotic or the meropenem for the treatment of the typhoid fever. Again, I have already said that the extensive clinical data is there. I will not go in detail. And it is not the immunogenicity. It is not only the efficacy. It is not only the effectiveness. The most about that, we should not harm the normal healthy child. And therefore, you can see that in a phase 3 clinical trial, the vaccine has been found safe in only 86% of cases. And whatever the side effects are there, they are quite minor. Majority of them will have either a low-grade fever or some pain or the swelling. So there was no a single adverse effect which has asked that we have to stop that vaccination. So I think the vaccine is hugely safe. So it is effective, it is efficacious, and it is safe as well. And we have got the robust data, post-marketing surveillance. You can see phase 4, again the efficacy. You can see this again that most of the adverse effects following vaccine were found to be mild in nature. So I think the vaccine is quite safe as well. Then another was whether previously that this type of TCV vaccine cannot be given with the measles containing vaccine. Now we have now sufficient data. There has been no interference with the measles containing vaccine or with the MMR. So co-administration of the typhoid vaccine with MMR vaccine does not interfere with the serological response. So you can jolly well give with a 9 months MMR along with along with our TCV vaccine. Now this is about the most of the studies are from 0 to 6 months or 2 years and 2 years to 45 years. Now the $1 million question that can this vaccine be used above the age of 45 years? Do we have any study? Yes, with our vaccine as that. You can see the open label study to evaluate the immunogenicity and safety of typhoid conjugate vaccine in an adult for more than 18 years and less than 65 years. A single dose of 0.5 TCV was given, and if you look at anti-VI and at a baseline were almost similar in both the groups. But if you look at that after vaccine, it is 12 units per ml and 30 per unit in group 2, and there was a similarity in the groups in terms of post-vaccine antibody, and they shoot up in more than 1,000 and more than 1,500 with a 95% of the confidence interval. So the vaccine has found to be highly immunogenic. You can see this from this baseline of 12, it has to 416, nearly 1,400, and from baseline of 13 units, it got more than 100. As far as safety is concerned, again, in a group 1, the vaccine has, you can see some pain, fever is minor, so minor side effects are there, but you can see the incidence is quite very, very low. So the vaccine is not only immunogenic, but vaccine is also safe. So the safety analysis revealed that most of the AEs are mild. There is no serious adverse effect was encountered, and based on the results of this clinical, we can say that this vaccine can safely be administered up to the age of 65 years. So we have got data till the age of the 65 years. Let us not stop here. Do we have a data that the vaccine can also be used above the 65 years, because my grandfather is coming from USA to here. So can I protect him with the typhoid? Yes, we have got it. So typhoid TCV is reported to be safe and induce similar VI antibody genetic matter in young and elderly adults, and that is from 6 months to above 85 years, which is the average. So we have got data till 45 years, that is 7 years. We have upcoming data in the public domain for the 65 years, and again till the age of the 85 years. Only 1 minute, yeah. So there is a comparative immune response of the typhoid, DCV typhoid in extremes of the age. From 6 months to 85 years, we have got the data there is there. So in this again, the age extension study, 300 subjects were included, and the two group, 18 to 65 years and 65 years to 85 years, and we have got a similar safety and immunity in all these age group as well. So to summarize, friend, a 0.5 ml single dose from 6 months to 85 years, we have got the data available, which is in the public domain. ACVB recommends up to 18 years because we practice till the age of 18 years, but now the onus is on us to start the adolescent vaccination as well as the adult vaccination. WHO has given the recommended age from 6 months to 45 years, and never ever forget to vaccinate the travelers at least 1 week before the departure. Similarly, food handlers, a person who is working in the restaurant can also be given vaccine as a aid. The two practical issues: can the typhoid TCV vaccine can be given to a child who has recovered from the typhoid? Yes, typhoid is a bacterial disease, and unlike most of the viral diseases, they do not give lifelong immunity. So usually give the vaccine when the child is stabilized, that is usually 2 weeks after the child is recovered. And can we give TCV after typhoid VI? Those who has a pure polysaccharide can give it? Yes, it can be given 4 weeks after the dose of the pure polysaccharide vaccine. And this is the last slide I would say, that this TCV, you can see it has got the more than 65 to 85 years now data is available. Majority other vaccine is 6 months to 45 years. It is patented, proven. This is the only vaccine which can be used as a reference vaccine compared to the other study. We have got the human genome study. We have got the efficacy data in the countries where the epidemiology is similar to our India. That is so it is very important. It is also helpful against the XDR vaccine, XDR typhoid vaccine, and we have got the extended control temperature condition. It is quite compliant. So vaccine is quite stable, quite safe, quite immunogenic, quite efficacious, and that is true in our, and it's boostable in our country like India. So I think the first TCV vaccine which the WHO pre-qualified, only TCV which has established long-term efficacy and immunity data, only TCV which can be used as a reference vaccine, only TCV with proven efficacy across the 3 continents, only TCV with proven booster dose effect, and proven vaccine with non-interference with other MMR vaccine, and proven safe and effective in all the age groups. So thank you very much for your patient hearing. If you have any question, I will be happy to answer it. Thank you so much.